Welcome, everyone. We are joined today by Dr. Thorisdottir, the Chief Analytics Officer at Planet Youth. She is joining us today to speak on the community-based youth prevention and alcohol reduction model initiated out of Iceland and implemented in 3 Canadian communities. Welcome, Dr. Thorisdottir.
Thank you. Thank you so much for having me. My name is Inga, as Todd said. So I'm the Chief Analytics Officer at Planet Youth. I'm located here in Iceland. And I am very happy to be here with you today to talk about the Icelandic prevention model and our approach to substance use prevention in Iceland and in wider communities. So let me see if I have. So let's just start from the beginning. So this is a picture taken in the middle of the night in downtown Reykjavik in the summer of 97. So this is actually when I was a teenager. So the city center was just full of drunken young people and usually just children. And at this time, we had more than 40% of all 15 to 16-year-olds in Iceland that had become drunk for the past 30 days. 23% were smoking cigarettes daily and 17% were using cannabis. So in general, we were scoring quite high compared to other European countries. And today we are scoring among the lowest. And I think together we are here because we all share these concerns about substance use. And in relation to that, a list of other sad things such as self-harm, suicides, delinquencies. And these are large-scale problems in most countries in the world. So the fundamental question really becomes what can be done? And I think we may all agree that the obvious answer is simply to eliminate substances in any form. And this is what governments around the world have tried to do for years, decades, and centuries, using different methods in fighting the creation, distribution, and sales of drugs. We have alcohol prohibition laws, taxes, regulations, prison sentences. And the focus has been on fighting the supply. And success has been incremental, if any. And our approach is that there is a second answer, which tackles the issue from another more upstream thinking angle. So namely just driving down demand. This calls for more long-term thinking, but the results are also more rewarding. And this is really the origin of the Icelandic prevention model that the Planet Youth methodology is implementing. So how was the situation really turned around? So the picture was from 1997, and in Iceland, we had a bunch of scientists that started working on understanding these risk and protective factors within the environment of youth. And because substance use was increasing at this time, in 1999, ISRA, which is where Planet Youth started, was founded, and we started doing youth surveys. A year later, we made an agreement with the municipalities in Iceland so that we would actually funnel the information back to the municipalities. And then 6 years later, we had the Prevention Day, and prevention was very much on the agenda, and it has been pretty much ever since. Of course, we have to continue educating new politicians, and we have to keep on lobbying for this, but prevention is still very much at the core of what the municipalities are doing. And so this is really what happened, and we're very proud of this picture because we can see that we were scoring very high in 97, 98, and this has been a downward trend, and also not just a downward trend, but we've been able to maintain this for a long time. And that is extremely important because often when we get the success that we were aiming for, we kind of relax and start shifting our focus to other things that are also pressing, but we need to be able to maintain what we have achieved. So you can see that drunk in the past 30 days went from 42% down to 5%, daily smoking from 23% down to 2%, and then cannabis from 17% down to 6%. So this has been this huge, huge change in Icelandic society over the past 20 so years. And people often think that we're just weird up north and just a small nation, and it's easy to see how this happens. But we tend to compare ourselves to the other Nordic countries. And although many of the Nordic countries have seen a decline in alcohol use, and many other countries over the past decades, none have seen the same steep decrease that we've been able to see in Iceland and also maintain. So why am I telling you this? Well, we have just been very much focused on working in our Icelandic communities. We're working with communities around the world. So the critical difference between the Planet Youth Guidance Program and many other prevention approaches, is that it is a timeless process structure for collaborative partnerships with an upstream approach. So we're not just creating an intervention that is supposed to work for 1 year and hoping that we see something downstream. We are constantly working towards creating this better environment for children. Everything that we do is data-driven, so all of the theories and everything that we work from is both based from the wider scientific literature and also from our own findings. And collaboration is really the central feature of the work. So the methodology is based on the Icelandic prevention model, as I said before, which is then based on 4 assumptions. And these assumptions are really important to keep in mind. So if we think about that substance use initiation risk is not randomly distributed in the population. It's not that there's just this person starts and this person starts and this person starts. There is a certain profile that we can look at. And what we want to do is try to change this profile, create supportive factors for those that have an overwhelming amount of risk factors. We also know that behavior change is notoriously difficult to accomplish. And we also know that in primary prevention, there actually are no quick fixes or simple solutions or short-term band-aids to put on and everything will be better. So population changes, they will require long-term population level interventions. So we match the scope of the solution to the scope of the problem. And keeping this in mind, the Icelandic prevention models is based on linking key actors in the community together to create this change. So we want to integrate the relationship between researchers, policymakers, and practice so that we bring everybody to the table to work together for the solution that works in their community. So this is a guidance program. We're not telling people this is what you should do, because we really need to know where the community stands and what the community can also do with the resources that they have and where we need to add on to these resources. So the number one thing before we actually start working with the communities and also before we try to make change is understanding the risk and protective factors. So there are universal risk and protective factors that we can take from one side society to the other, and then there might be specific risk factors within societies that we need to examine. So we know that the risk factors are those that increase the likelihood of substance use. For example, if you have friends that are doing substances, you have a large amount of leisure or unstructured leisure time where you're just hanging around with nothing to do. And then we also know that there are protective factors in the lives of young children and adolescents that do decrease the likelihood of substance use. And most of these factors are quite well known. So this would be parental monitoring, parents knowing where their children are at in the evening. Also just views towards substance use. Do parents perceive it to be okay if their adolescents are getting drunk? Do they buy the alcohol themselves? And then we get surprised when we have a more complex issue than drinking with your friends on Saturday nights, and then it's just goes into becoming an abuse problem. So these are all things that we need to think about. And the Icelandic prevention model is actually based on these on specific domains. So we have the 4 domains that we focus on within the local community. So it would be the family, it is leisure time, both structured and unstructured leisure time. We focus on the peer group and the school, and then also on individual factors. So understanding that each of these communicate together. So if we have a broken link in one of the domain, we might need to strengthen the other domains. And this is, for example, if we have difficult situations at home, then we might need to be able to provide these children with other environments to foster their hobbies and to help them grow in adverse circumstances. So the model is actually based on like 5 guiding principles, and I'll go into these in detail. So it is to apply a primary prevention approach designed to enhance the social environment. It emphasizes community action, and normally we embrace public schools as the natural hub of the neighborhood to support child and adolescent health, learning, and life success. The third one is to engage and empower community members to make practical decisions using local high-quality data and diagnostics. The fourth is to integrate researchers, policymakers, practitioners, and community members into a unified team dedicated to solving the problems of the community. And the fifth is to match the scope of the problem, the scope of the solution to the scope of the problem. So this emphasizes long-term commitments within the community. So if we think about the first one, so the model aims at preventing substance use by altering the social environment in a way that it reduces the likelihood that young people will initiate use. So we cannot assume that children and youth are rational social actors, that they make their decisions despite their social environment, but instead that they make their decisions because of their social environment. So we need to think about how can we create a social environment that fosters healthy decision-making. So we want to address the underlying costs, so the cost of the costs of substance use initiation at the societal and local and community levels. So with this principle, so we often have to think about the resources that we have. We need to be able to have personnel to guide the local team building. So this is if we are starting to implement the Icelandic prevention model, and we need to be able to bridge the use of the evidence to the community, so that we have a team that is focused on creating this change. So the primary unit of intervention is the neighborhood, and in most circumstances, the neighborhood is the service area assigned to a local school. Of course, in communities where we have a lot of schools that children go to where they're not like linked to where they live, we might need to rethink this, but usually this is a very good unit to work with, because the school is also a bridge between the home, and then we can reach the students, we survey them within the schools, and then we can also disseminate some of the findings through the schools. This does not mean that this is the school's responsibility. Schools are overworked, and this should be an added benefit for them instead of creating more work. So the model addresses family, school, peer, community, social influences, and other opportunities within each neighborhood. So when you receive your findings, you're able to understand more within the neighborhood context. The aim is then to strengthen the connections between families, schools, the community at large. And then we want to create, like, as I said before, like a team that is going to be implementing the model. And this team is usually well defined. We need to define it well at the beginning, because both when you start doing something, people might fizzle out or get a new job, and then we have to kind of make sure that we still have the adequate team in place to carry this forward. And as I said, the schools are just extremely important, and having this collaboration and commitment from the schools to both to collect the data is very important. And often in the beginning, this can be somewhat complicated or tricky, but then as time goes, this becomes just a very much normal part of like the procedure, and there's a communication line within the schools. But this is a very important aspect of the model. So what happens then is that we survey the kids, we get the data back, and then we want to use the data so that the local team members can make their decision based on hard data. So we need to both use the data to capture, focus, and sustain the community attention on local factors essential to preventing substance use. Often, communities are well aware of what's going on. They know where the problem areas are. They know where the strengths are. But having this data allows those implementing the model and change in the community to bring other stakeholders to the table. And that can be a very valuable thing when you're trying to create long-term change. It's like being able to sustain the focus. And the data also helps in guide the selection of strategies and the development of the community capacity that is necessary to address this complex problem of substance use. So to do this, we use data it's local, it's straightforward, accessible, jargon-free, and we try to provide this very quickly back to the partners so it doesn't just sit in our drawer collecting dust. So we try to funnel it right back into the community and then have a dialogue around it. Because local and timely data, it does strengthen the opportunities to accurately describe, diagnose, and inform community decision-making. If the data is too old, it is less likely that people will make decisions for tomorrow based on data from 2 years ago. And then we have the guiding principle number 4. This is to integrate researchers, policymakers, practitioners all together in this one team. So commonly, this bridge between these different stakeholders has been more theoretical than functional and practical. And even just people working in different departments, working somewhat towards the same objectives is lacking. So even we have seen when we start creating this, that it's just the process of how people work and how people delegate projects between each other can change quite quickly, and we can better use the resources that we have. So we don't want each group to function in isolation. We want them to work together towards a common solution and towards creating this society that we want to see. So everybody contributes, and all are needed for success. So we need to have researchers talking to policymakers and administrative leaders, practitioners. We need community members. We need parents. We need teachers, coaches. So we really want everybody on board. So we're all together working towards this. And the final is really to match the scope of the solution to the scope of the problem. So we know that the social conditions that promote substance use among young people and people in general, they emerge from multiple complex sources over a period of time. It just doesn't happen overnight. There are so many different things that are creating the environment for substance use to be an issue, really. So we want to focus on creating solution to counteract or mitigate or eliminate these social conditions. And this has to be part of the problem solving that we're undertaking. So if we think that these problems take a decade or 2 or 3 to be a problem, we can also think that it takes a decade or so to get back. So we need to have this long-term vision. We need to have long-term planning and sustained attention. So this is really where we come into the iterative and repetitive approach of the Icelandic prevention model. So we have these 5 guiding principles, and then there are 10 core steps that we follow, and each community that we work with follow these steps. I won't go into them in detail due to the time that I have, but in general, this would be that in the beginning, we identify the stakeholders. We create a team. We create people that actually care about the cause, that are going to work together, that are going to take the data when it gets back in. We know where we need more capacity. We identify the capacity that we have, the resources that we have, the funding that is available. And then we start working with the communities. We start to prepare them that we're going to collect data. We introduce the model. We try to address all the concerns and all the questions and everything that they have in advance, so that there is a collaboration spirit. We do the data collection and the processing, and then when we are delivering the data, we actually get the opportunity to enhance this community participation and engagement. And then we disseminate the findings as widely as we can. And then the community sets their goals. What are they going to achieve between the data collections? How are we going to measure the changes? And we know that we might not measure any outcome changes in the first year or 2 or 3 or 4, but hopefully we'll be able to measure process changes and that we're working differently. And then as this develops, then we start talking about policy and practice alignment, and hopefully this becomes immersed into the policies that we have and that are being created on a daily or weekly basis. So, and then it's just repeat and do it again. So it is we try to focus on this as a 5 years program, because any shorter than that would just be measurement. And that really isn't the aim of what we're trying to achieve. So we do collect data, we disseminate the data, there is a strategy and action plan. What are we going to do? And then we monitor that. Are we doing what we're saying that we're doing? Because of course, if you want to do something, but you don't really do it, then you can't expect anything to change. And then we have this process over, so either you collect data every year or every other year, and then that is just the benchmark. You're not trying to change the behavior of those that you're collecting the data for. This is where we're using as a benchmark of where the youth is today. And the interventions that are designed, they can go even younger than for the 14 or 15-year-olds that you might be surveying. If we, for example, see that a large number of adolescents start the initiation of substances at or before 13, then we want to address this well before that. So these are just things to think about when we're moving forward, that this is an upstream approach. So we need to think about this long term. So this is really what's been happening. So I'm not going to tell you where we've been working in the past 4 or 5 years or so. So Planet Youth has become quite global. So we have been working in, we have ongoing projects now in 13 countries. We have surveyed over thousands of municipalities, I would say hundreds of thousands of adolescents. And so far, the experiences have been really good. We have been learning a lot from other communities because, as you know, Iceland is a small island. And then when we are applying these strategies in different communities, it's wonderful to see how much knowledge people have for the local community, and also how much can be done when people actually work together. So we started in Chile, for example. The first pilot cities started in 2017, 2018. And in 2021, it was the first whole country outside of Iceland to implement the model. And it has been embraced under the President Piñera under the name Eligi Viversin Drogas, and it has had various implementations. So these are over 300 municipalities where the implementations are, of course, very different between the municipalities. But this is one example where the entire country has kind of embraced this, and it's quite large. It's a lot bigger than Iceland. And also just learning from other cultures how we need to focus on different risk and protective factors. Then we have also Mexico. So Guanajuato in Mexico, there are 46 municipalities, which is the entire state of Guanajuato, that are implementing the Planet Youth methodology with the Icelandic prevention model. Last year, we held a conference there with the state of Guanajuato, and it was very well attended despite the pandemic. And they have also worked really, really well at implementing this, because they've been focused so much on creating these teams in the beginning. So if you have 46 municipalities, they've hired around 100 employees to create these teams, but this is very much a state-driven initiative. So we have a country-driven initiative in Chile. This is a state-driven initiative. And then we have also communities in the US, for example. We have Frankfurt in Kentucky, we have Idaho and Vermont. And these are a lot smaller communities, but they are doing their own version. So for example, in Iceland, we have had a huge success with leisure, like, what's it called? Like paid, like leisure activities where parents get like a part of the leisure activity funded. So each child gets like a leisure card. And now we can see that other communities have taken that to heart. So Frankfurt, Kentucky has created the Yes card, which is some form of a gift card for leisure activities. And these communities are using the data that they have as the foundation for community-led efforts. Then we have 6 sites in Ireland that are implementing the Planet Youth model. So 3 of them started in 2017 and have been doing this now, are on their way to the 3rd data collection. And they have really, really strong prevention work. They're engaging parents from very like young ages, trying to get the parents of young children to attend really. So they talk a little bit about the model and about substance use, but they focus a lot more on mental health and sleep. And since they are talking to younger parents, but also talk about all of the risk and protective factors, really. So they are helping parents to create this knowledge on what are the protective factors, but they're not talking about substance use. They're much more focused on mental well-being and sleep. So you can check them out as well. They have a website, I think planetyouth.ie. And they have created so much awareness with the data that they have. And then we have an agreement with ADF, which is the Alcohol and Drug Foundation in Australia. And we have agreements in 7 municipalities. And they have also implemented what we call a prevention capacity assessment, which is not serving the youth. It's more about the readiness and the prevention index that we have. So I can tell you a little bit about that later if I have time. And they've collected data now for the 2nd time, and we can see they have a very different structure than the other areas that we're working with, because they do already have teams in place. So like it's called LDAT teams, which are like local teams to work on substance use prevention. So I think it's a lot about trying to bridging the resources that we have and working more towards this common goal. And then we have Lithuania. They started in 2006, and there are 3 sites there. And we can see that substance use is on the decline in that area, but they have been doing this since, so they started with Youth in Europe, and then which was funded as like a pilot project. And then now they're still working with us, and it's really good to see the changes that have been ongoing in their community. So a little, I'm not sure how much time I have, but I will go a little into the developments that we have been doing. So implementing the Icelandic prevention model, it seems pretty straightforward, but then when we go into different communities, we see that there is just so many questions. And so we created this implementation guidebook. And this is something that we provide our partners with. It's all the questions, it's going through the process. And then we also have a community on Facebook, which is for idea sharing and knowledge exchange platform for our partners. And this is very valuable because people in the same position, they're able to share material, they're able to share ideas. And the approaches between the communities in creating this change they're so different. And it's so good to be able to learn from that. And then we have the prevention capacity assessment. So this is really to answer questions about what's the comparative quality of the municipality prevention structure and activities. how ready is it to improve its prevention approach? Can we do this at a municipal level, or does it have to happen on a national level? Is it like legislation? Do we have responsible alcohol beverage service? And so this is more of like the structure that we have. Yeah. So this is a list of our publications, and if you are able to see them, I am not, but feel free to screenshot this. So, and that's the end of what I was going to say. I look forward to your questions if there are any, and feel free to contact us at planetyouth.org.
Thank you, Dr. Thorisdottir. There is one question I can go into very quickly, and it is how can nonprofits with very limited budgets attempt to implement this model or its steps in order to better serve our communities?
Yeah, let me see. Am I muted? No, okay. Yeah, so I think reading the papers that we have, of course, the guidance program it's quite big. But I think if you go through the papers that are already published about the guiding principles and the 10 steps, it would get you a good idea of what can be done to strengthen what you already have. So I think that would probably be the best place to start.
That's great, thank you. So the implementation guide is there for people to pull from and adapt to their own resources. Thank you very much. I really appreciate your time in the presentation, as everyone else, I'm sure.
Thank you.